Good day and welcome to the SNN.Network Summer Virtual Event. Our next presenting company is Mednow. It is now my pleasure to turn the floor over to your host, Kareem Nassar, CEO and co-founder of Mednow. Sir, the floor is yours.
Thank you so much, Rich. And everyone, a pleasure to have you join us here. Thank you so much for your interest in Mednow. And let me get started by telling you a little bit more about our story. Mednow is a publicly traded entity that today trades on the TSX-V under the ticker symbol MNOW. We are Canada's on-demand virtual pharmacy, and our goal is to build a healthcare technology company that's anchored in pharmacy, going after a $47 billion market with $30 million in the bank today to help us build out that vision. Just a couple of notes relating to forward-looking statements and jumping right in. So as I said, it's a $47 billion market that's not at all disrupted today through a digital channel. What we're excited about is creating not only a digital channel, but an amazing experience at it. Because pharmacy is primarily publicly and privately fully reimbursed, where individuals don't necessarily have to ever pay for their own meds, there's a lot of value in creating an incredible experience. And that's really where we're focusing all of our energy, and we're going to do that on three different ways. We're going to have a national pharmacy that is supported by a superior healthcare digital experience. And then lastly, support it all with a robust logistics network that gets you your medications as soon as possible. Our management has already built various pharmacy businesses in other companies that today amount to $200 million in revenue. All of that experience comes together in a way that we are using here at Mednow to establish a very profitable entity with a focus on pharmacy first, but healthcare second, as in bringing in telemedicine, mental health support, and various other ancillary services that make our offering really unique and quite sticky. Healthcare market in Canada is massive. It's a $260 billion market that today doesn't have really much of a disruption in terms of technology. This is why we're really excited to be one of the pioneers in that space. We've already seen what Uber has done to transport and to the food delivery business, and we seek to do the same thing for healthcare through our technology platform and our service. Why we focus on pharmacy is, of course, to our experience, but not only that, digital pharmacy happens to be one of those markets that is completely nascent, and we are one of the first ones in this $47 billion market that are coming at this channel digitally. To give you an example of how insignificant the play has been in digital and why we're really excited about this disruption, almost 99% of the market today is serviced through brick and mortar pharmacies that are coast to coast. We're talking about 10,000 pharmacies, all chasing local business from street corners. And our solution, which with one fulfillment center, for example, today where we are in Toronto and Vancouver and soon expanding to our national offering, we can service entire provinces from one fulfillment center. So it's a very different approach to pharmacy. It's about making the experience that is a digital one very, very wholesome and holistic, that no one really needs to come into our pharmacies to see our pharmacists, even though that is also entirely possible. Pharmacy is a need that is very significant in the healthcare system. We're solving a very significant problem around adherence and generally around access to good drug therapy. In fact, 10 times more likely is the number for somebody to see their pharmacist versus their physician. So really, truly, what a pharmacist provides in terms of healthcare advice is the reason they are trusted and also the reason they're extremely accessible. With Mednow, we create a digital channel to that player, and we feel that that's a very important solution for the market that we are in right now. We've come at it with a very unique approach. We think it's a lot more than an app that's going to cause disruption in the space. To contemplate all of the other things that are come into play, we've got, yes, the app that today is in Apple and Android stores. We've got a national call center if somebody wants to rather call us than use our app, and many other ways to connect with us to make us extremely accessible as a pharmacy. Once we've established contact and we're about to service somebody, we can get them their medication delivered same day in the Greater Toronto area and the Greater Vancouver area, which are one of the most populous cities in Canada, one of the largest in North America, which for us is the reason why a lot of people switch us. It's that convenience of not having to leave your home and go line up at a pharmacy and wait for your medication to get filled. Finally, we bring in the true differentiator around integrating both virtual care or telemedicine or virtual doctors, or what you might want to call it, along with pharmacy, and providing that at a national level. So if anyone were to come see us and they maybe not having a prescription and simply just a health concern, they can see one of our virtual doctors. And if that visit results in a prescription, we can get that prescription filled the same day and have it delivered. That is in essence in the beginning of our offering in this patient-centered approach to healthcare. So yeah, today we can do diagnosis to delivery in Ontario and soon in British Columbia. And again, following that to a national offering very soon, where it really becomes evident that we are going beyond just delivery of medications is around some of our drug adherence solutions that focus on patients that are taking multiple meds and how to make sure they're well supported, because they also happen to be patients that have large baskets and we earn a lot of income off of them. Mental health support, especially after the pandemic, we invested in a company that allows us to also provide that as a service. I'll tell you more about that in a minute. Our business model is extremely attractive. We have come at this in a very progressive way. So yes, you can get a medication delivered. You've got yourself a cold bug and you need an antibiotic. We're getting you that delivered the same day. But really beyond that, building a relationship that is a digital one with patients that are taking multiple medications and on a regular basis is where we feel we're going to make a huge difference. It's almost like a subscription with lots of recurring revenue that is not just for 1 year, but multiple years, because patients stick around to pharmacies if they're happy with their patient experience. And that causes a much more elevated LTV. Finally, we didn't stop at pharmacy. We wanted to include telehealth because that is 100% part of the primary care problem that we're solving for. And as we add more products and services, we become a very much a household name in healthcare, and people have multiple reasons to come and see us. The revenue for Mednow is focused on a traditional pharmacy approach. Traditional means it's mostly covered by public and private payers with a very diminished buying hurdle for somebody to come and use our services, because in Canada, 90% of citizens have coverage for their medications and they don't have to pay for that out of pocket. This is something that we've already proven we can do really well in the brick and mortar world. And now with the virtual approach, it means we're going to create this ongoing relationship of a digital kind with patients. When you contemplate some of our existing metrics, $1,000 a patient per year for patients that are going to be around for 10, 15 years as they take their meds, and then including that our gross margin, which is a healthy 30%, we're very confident about building out that LTV and expanding that basket of revenue on an annual basis to maybe doubling, tripling, and even quadrupling it by having patients that take multiple meds. The revenue drivers, as I said, are well established. They are, by virtue of us being a pharmacy, accessible simply through our claiming mechanisms and all of the things that you would know well about pharmacy and the pharmacy space. The thing that I'm most excited about is our ability to be a national pharmacy. Why that is exciting is because it gives us access to the institutional market. An institutional market, understood a different way, is access to brokers, advisors, large national healthcare providers, whether that may be technology or doctor companies, all that are entities that have access to multiple patients and give us access to patients in an en bloc and an en masse form. That right away diminishes our CAC, but more importantly, it allows us to focus on the bigger problem where it comes to drugs, which is the drug spend. A lot of these entities that represent multiple patients are concerned about how a really good digital pharmacy offering can provide for a way to reduce drug spend and really become much more purposeful in how pharmacy operates. So rather than being this transactional, yeah, you give me your prescription, I'll dispense the med, you create relationships and support patients through their journey of care so that they are much better users of medication, more adherent, and therefore healthier. That's the kind of stuff that employers get excited about, and not to mention a very powerful way to get into that $47 billion market. We were planning only getting to this into Q3 of this year, but we already established our first win with securing the Police Pensioners Association of Ontario. That represents 12,000 members who are all now looking to us as a preferred pharmacy provider for their needs. This national scaling has already started in a very aggressive way. When we closed $37 million in our IPO of March, we ramped up our scale of development right across the board. Today, we're live in Ontario and British Columbia. We plan on being live in Nova Scotia and Manitoba, very, very quickly, and then the rest of the country by the end of the year. This is really all about making us the perfect match for an institutional business where they want to have their employees, for example, or their members if they're an insurance or a broker company, be serviced nationwide without any interruption to that through our national platform. We add to that by being not just national, but also have access to technologies that are rarely available at your average retail pharmacy. These technologies today give us an ability to pack medications in a compliance form that gives you these sachets here that you see in the slide that are marked with date and time with the medications content inside. So if you're taking 7 medications a day, you're wondering about which vial to pop and which medication to take. You don't need to do that anymore through the solution. All you do is you go up to your PillSmart box, which is that white box there in the center of your screen, and pull off one of those sachets with the meds and the pills in it, and you know exactly what you have to do today and in that moment to take medications. If you wanted even further support, we provide the carry system, which allows you to place that same strip of medications in the back of the carry health device. And at moments in the day where you need to be taking your meds, this device will alarm both visual and audio, to let you know that it's time to take your meds. So it's really about supporting aging at home. Just to give you a reason why this is very important, in 2014, the population above 65 years of age in Canada was approximately 50%. By 2030, that number is going to almost double to 25%. And really, it is a sign of an aging population that is naturally a heavy user of meds. So we're basically putting together the mechanism needed to be able to be the preferred pharmacy for exactly those high-use consumers who depend on pharmacy for their well-being. In continuing to support our aging at-home goal, we've acquired MedVisit, a company that has a long-standing history in this country with 30 years of experience. They are a home visit company, and we were able to acquire them at a very attractive one-time revenue, and this deal closed very recently, just last month. Just to give an example of the size of their business, 30,000 patients were seen last year alone at home, and they sit to support about 400,000 patients in their database for all their at-home needs of healthcare. Why this is really interesting is from us as a company that provides telemedicine as well. Telemedicine has its limitations, and sometimes you just need an in-person physical examination. So MedVisit provides that for us and allows us to, for cases where telemedicine doesn't work, we can have MedVisit doctor visit you at home. We are today using this platform in the Greater Toronto area, and we plan on expanding it out nationally with hopes to really be able to provide that service, again, in anywhere where we are present as a pharmacy. Another key need that we know is very important for our customers and the Canadian population, almost to the tune of $6 billion as insurance would cover for mental health services. This is as recently as 2019. 75% of people will experience a mental health care issue at some point in their lives, and there's no reason to think our customers don't have the same needs. So we've invested in a company called Life Support 247 that provides a really good way of triaging mental health issues and basically aligning patients with mental health care providers that can really get you out of just having to service this individually. And what's unique about it is for a digital pharmacy to offer that, it creates a flow of potential prescriptions that come from these exact same patients. I've spoken to you about our founding team and their experience, and one of the key things that we are very excited about is continuing to keep up a very rapid pace of development of our service. As I mentioned earlier, Q1 of this year, we raised $37 million in an IPO on the TSX-V. We've used these funds to already go out and build Nova Scotia and Manitoba and continue to build out our national pharmacy footprint for conclusion of that by the end of the year. Our institutional business was only planned for Q3, but we've already secured the Police Pensions Association of Ontario and continue to have very active discussions with brokers and other players who represent large groups of patients to the tune of, in some cases, 250,000 in one shot lives, that is 250,000 lives. So we're very excited about already being on our way to build that business. To give you a sense of how well this business is appreciated in the U.S., where the market is a little bit more mature around digital pharmacy, Capsule and Alter both have unicorn valuations, and they're present just in a handful of cities. We, with our goals of being national, expect to arrive to these valuations and not exceed them in the very near future. And just to continue along the value of really being very efficient in the delivery of medications, PillPack, a company that Amazon acquired in 2017, was acquired for $750 million USD, and all they had was the PillSmart offering that I spoke to you earlier. So it just shows that this unique offering is highly valued and appreciated in the U.S. market, and today in Canada, as we pioneer the service, we expect to exactly arrive to the same place. Myself, I'm a computer engineer by trade who spent the majority of his career in healthcare. Haven't understood that market really, really well, especially how to make money in it through the pharmacy economics piece, where I had spent a few years supporting strategy at McKesson Canada, which belongs to the enterprise of McKesson, one of the largest wholesalers and distributors of medications in the world, a Fortune 11 company. Really understanding that, in addition to the logistics of healthcare through my experience at a home healthcare company, is what I'm bringing here to Mednow. I'm well supported by pharmacy entrepreneurs that have built other massive businesses that are already well on their way to be very profitable. And just for what it's worth, check out some of the comparables for their businesses as you explore this space for us. Ben Ferdinand, our CFO, is a man with multiple years of experience in public markets. He knows how to grow businesses in this public market realm and through the allocation of capital extremely strategically, so we're very happy to have him on. As we expand beyond pharmacy, we've looked to key experts in telemedicine, Dr. Kim Villani and Chris Fisher, as well as in tech and e-commerce to really make sure we're well positioned in this transformation of healthcare from the physical realm to the virtual one. The signs are already obvious that this is working. We have a 5.0 star rating on Google, and it really has been an impressive sign of why individuals want to move away from the traditional form. They find the convenience amazing of being medication delivered right to their home. But more importantly, the fact that they can text their pharmacist is a real game changer. The fact that they can reach out to this healthcare provider who today one could argue is extremely underutilized in the market of healthcare, because you'd have to either go and line up at a pharmacy or call and be on hold. Now that you can just text them, has created a new and important access point to this very, very well-trained clinically healthcare provider. And, it's already showing in our reviews. We plan on using this momentum that we've built in the B2C market to, again, go back to our institutional clients and give them other reasons to want to join our movement and what we're doing with digital in terms of healthcare. We've got a few papers that have reported on us based on our performance, and we continue to publish on a regular basis based on, for example, our acquisitions and the way we're coming at this business to really secure an important channel, which is the digital one, to healthcare, both in pharmacy and telemedicine. And with that, I come to the end of my formal presentation. I'd love to hear some of your questions, and thank you again so much for your attention. I have here a question from Robert Kraft. Thank you, Robert, for that. And yeah, that's a great question. One of the key things that we have noticed in healthcare has been the consumerism in healthcare. People are much more attentive to their own needs in healthcare. And when you enter our example in Canada, a publicly funded market where you kind of get what you got, it's available without very little differentiation, we've already seen signs of how medical clinics try to differentiate from one another, how pharmacies attempt to differentiate from one another, maybe by basic offerings like delivery or such. But truly, the idea of engaging a customer in a way that's extremely personalized, in this case for us as a digital channel, we feel is going to be the true catalyst of our business. We've already seen what happened in telemedicine, 60% year-over-year growth. People are very keen on going digital for their healthcare, but now this is the next step, which is personalizing their care, precision medicine, all things that you can do much better with a digital pharmacy than you can with a traditional one. And then lastly, when you start thinking about the cost of medications and how it affects employers who are covering the cost of all of their patients or employees' meds, really coming at this with a very aggregate view of data and really being a digital-first pharmacy means we have access to massive population-wide data. For example, if you think about a company that is having their patients go to multiple brick-and-mortar locations that have different systems that all sit separately, you send them all to Mednow, and now there's one central place per province that aggregates all of that information and therefore puts us in a much better place to manage their healthcare spending. So again, to summarize, three things: consumerism in healthcare, recognizing that the pandemic has sped up digital health adoption in a very, very rapid way, and things that could have taken years are now going to take months to become reality. And in third place, healthcare spending and the reason we need to control it and why digital is the right channel for that. Thanks again for the question, Robert. Thanks for the comment too, Robert. Appreciate it. Okay, I'll hold on a minute more to see if there are any other questions. See some familiar names in the company list of our audience. Thank you for attending. It means a lot to see you here and just for your support, as always. Okay, it looks like there might not be any more questions. Thank you so much for your attention, everyone, and for your interest in Mednow. Please don't hesitate to reach out to us at ir@Mednow.ca. If you have any questions about the company, you can also go to investors.Mednow.ca, or if you want to learn about our offering, quite simply go to Mednow.ca. Thank you so much.
Ladies and gentlemen, that does conclude the Mednow presentation. Thank you for joining us. You may now disconnect.